I'm Jason Altmire. I'm the Senior Vice President for Public Policy, Government and Community Affairs here at Florida Blue. I've been on the job for about 6 months. Before that, I was in the U.S. Congress. I was a member of the House of Representatives. I represented a district in Pennsylvania, and I come from a healthcare background. My entire background has been through the provider side. I worked in the hospital industry for many years before I first ran for the office. So I did have a healthcare background during the deliberation on the ACA, was very involved in that process throughout the evolution that occurred over the year and a half it was being debated, and served 3 terms in Congress, and now I'm excited to be here at Florida Blue. You'll find in the Affordable Care Act, in the deliberation, there was a lot of discussion that occurred on the provider side, on physicians and hospitals and skilled nursing facilities and nursing homes and all of the issues associated with those sets of providers. And what ended up happening is that was just too difficult to deal with, in large part because of the politics that were involved. So with regard to the finished product of the ACA, there isn't nearly as much dealing with the provider reforms and the delivery system reforms as were discussed in the beginning. The bill does a lot to cover people through the mandate to cover people who don't have insurance today, and that's a wonderful goal, and we need to make sure that we're doing everything we can to make sure people get enrolled and are able to benefit from that. You don't see a lot of insurance companies that are doing what Florida Blue is doing in Florida, to partner with providers through accountable care organizations, patient-centered medical homes, to have providers working together to share information, to lower costs, to be more efficient, and to share those information points with the people that they serve. And Florida Blue is really the tip of the spear in the whole country, taking the lead on these things that were left undone in the ACA. And if you look at Florida demographically, we have a population that the rest of the country is going to look like years from now. Such a diverse population, an aging population. A lot of the health issues that are unique to Florida are going to grow throughout the country. So in a way, it's sort of a model for the rest of the country to follow. And when we go out into communities and we serve our policyholders and we provide information to communities, we do it working through providers to make sure that they're fully integrated with the decisions that we make, that they're on board with the direction that we see the country headed and we see Florida headed. And I think if you look at Florida Blue's leadership on this issue, I think the provider community is a key to the whole thing, because we have to find a way to move away from the fee-for-service system that had some incentives in there that aren't going to fit nicely with the way the ACA is structured. We have to be innovative. We have to be able to change our approach. And I think the provider community wants to work with us on that. So that's going to be what we do moving forward. I'm sure providers throughout Florida are getting tons of questions on the ACA, and it's going to grow every day. When that October 1st date comes and the exchange opens up, people are going to say, what does this mean for me? What's my relationship with my doctor? How is that going to change in the new environment? So we're anticipating that. And when you hear Florida Blue accurately describe ourselves as a health solutions company, what we mean by that in part is the consultation that's going to be required, because providers know as much about the healthcare system as anybody in the country. They may not know all of the details of the ACA and what specifically that is going to mean to the people that they serve and the patients that they have in all the various states that they have as far as their health care. And we offer, and we have an app, we have an ebook, we have retail centers all across the state, 5 more coming online by the end of this year. So we are doing everything we can to get information out there on what does this mean for providers, for the patients that they serve. And through our Florida Blue website, we have a great and growing presence on our webpage, frequently asked questions that people are going to encounter. But in the end, this is a new experiment, right? This is a new law that's just taking effect after 4 years, and we fully anticipate that there's going to be stutter steps along the way. There's going to be some missteps in the beginning. You don't know what the unintended consequences are going to be, and we're going to be ready to help providers to navigate through the system when these unforeseen events occur, because we've been preparing for it for years now.